So hi everyone, this is Dr. Shabana Khan and today is day 4 of our clinical MRCPCH examination, and we are doing the clinical station, and now we are on the neurology. So this is the second topic. First we are done with spina bifida and now we are on the cranial of palsy. As I previously discussed that I will be just posting the examination video too with the patient. Now I am just explaining in verbal. So this is only verbal steps to memorize. So now what we have to do actually, 4 minutes outside the examination room, 9 minutes inside the examination room, right? During this inside examination room, 6 minutes is with the patient and 3 minutes with the examiner. So your time start now. For 4 minutes you are standing outdoor, like outside of the examination room. So for example, if I'm the person candidate, so I'm just standing outside of my examination room. I'm just waiting for the bell till ring. As the bell will be ringing, I'll go inside the room with a very confident face, like then when I just enter into the room, I will just listen my command, whatever my examiner is saying. For example, my examiner is saying that do the facial examination. This is the 9-year-old child. I just heard my command, only facial nerve. He didn't say anything else. So I was just doing the facial nerve, right? If he's saying do the examination and lower motor, if he's saying do the examination and general physical, right? So I have to listen my command first thing and very carefully. I'll just listen my command. I'll turn my face toward the patient and the attendant with the patient. So I'll see on my inspection, I'll see the room. Is my patient is with any dysmorphic feature, any respiratory distress, any abnormal sign of the movement, anything like which is very vigilant. As a vigilant doctor, I have to appreciate this, that my patient is in distress, or he is sinus, or he is tachypneic, or he is nervous. So I have to appreciate that. So I will first initially, this is my inspection, because my time period start now. So during this 6 minutes, initially my inspection, and I'll see that I'll just see my patient. If he's fine, he's breathing well, he's okay, he's interactive, then I'll just see around towards my room. If he's on the wheelchair, or if he's using it, if he's using any stick with that, and if he's using any special shoes, any special aids, like any hearing aid, any classes, anything. So I have to just look around, and then I just ask for my consent, like hi, this is Dr. Shabana, more the doctor who is working over here. I'm going to do examination on John, so can I just proceed with? So if he's saying yes, okay, so warm my hand. I'll just, on my inspection, I'll just see everything, and then if he's exposed, then fine. If he's not, because the command is only face, right? So I should not go to just open your shirt and this and that. So just my command is face. So I just look around and just, okay, John, you have to do whatever am I doing, right? Okay, can you do this for me? Yes. Okay. So John, now you have to, can you please up your eyes, raise your eyebrows like this, like am I doing it? Okay, can you just close your eyes tightly, and just close tightly. I'm just opening it forcefully and you have to resist against that. So if you close your eyes, so I have to just open it like on with my hand, and I'll check the resistance in the both eyes, like bilateral. And then can you please fill the air in your mouth like this. So I have to say this like this, because he's a very young boy, he don't know what to do, like, so I have to do whatever am I just asking from him. So, and with everything, like if I'm telling him that you have to raise your eyebrows, so I have to do this. And if he's doing to me, so I have to appreciate him, that oh, thank you so much, John, now you have to do this. Now can you please close your eyes tightly? So if you'll just close your eyes, okay, John, now you have to resist against me. I'll just forcefully doing it. So I have to do that. Okay, and before doing it, I have to keep just inform everybody that I'm just doing it. Before touching the patient, I have to rub my hand. And then, or if you are so much good in that, so we have to mention already that I have washed my hand with the special techniques, right? And then I have to just check the eyes, and then can you please fill the air in your mouth? Can you just whistle from your lips like this? So whatever am I asking to do, I have to do this, and I have to ask him to do same thing. So after doing it, can you please smile for me? Can you just, I wanted to see your teeth, like. And after doing all this, I have to check the behind the ear, any rash, any neck rash. And if I have time during this time period, because this is very easy to say, but this is very time consuming thing. If I have time at the end, so I have to ask this: are you good with the test? Can you test sour, salt, and sweet? If he say yes, then fine. And if I have time, then I can just make him to walk for me, right? And then I have to just ask for arthritis as well, and walk for me to just rule out the Guillain-Barré syndrome, right? This is how I have to do that. And but before this video, I explained that if we know what is the disease in my inspection, like for example, if I tell you that in my inspection I can feel that only lower face is involved, so I know that this is upper motor neuron lesion. So I know that what are the causes behind the upper motor neuron lesion. This could be CP, this could be MBS, this could be trauma. Now I have to rule out, okay? And for example, if it is eye and face, both of them, the full half side, then I know this is lower motor neuron. So if this is lower motor neuron, then I know that this can be Bell's palsy, this can be Lyme disease, this can be Guillain-Barré, right? Now I have to rule out accordingly. So if it is Guillain-Barré and Lyme, so this is usually bilateral. This cannot be only one eye or one half of the face, right? It should be bilateral. Now this is how we have to rule out. After doing it, this is my 6 minute. If I have time, I can do further examination like blood pressure, you know, to intracranial pressure raise. So I have to see that as well. If I have time, I can see the eye examination for cataract, conjunctivitis, like this. After doing it, when I complete my examination, I'll say thank you. The examiner will inform me, now you are left with 1 minute. Then I have to end my discussion, right? If I have just opened the torch or anything I have opened in my surrounding, I have to close this. I have to say thank you to him for my cooperation. Okay, John. So I'll say okay to him, and I'll turn my face towards the consultant. As I told you before, the consultant have to ask 4 questions from you. What is your, can you please elaborate your case? Number 1 question. What is your diagnosis? How will you manage this? How will you investigate this? So these are total 4 questions that he will be asking from you. So now you have to give him time to ask. For example, if consultant is saying, can you please elaborate your case, and can you please define a positive finding? And I know that because I examined the child, so this is lower motor neuron, only and only lower face is involved. No, half of the face is involved, sorry for that. So now what we have to do, so I have to just directly say that, okay, I have examined a John, he is well cooperative with me, and I can appreciate the half of the face is involved. It looks like this is lower motor neuron lesion, right? Or facial nerve palsy or the lower motor neuron lesion, I can say that. So you say, okay, what are your diagnoses? So as I previously informed you, and I also informed that we all of us, like at this level of clinical preparation, we all read about it, we all know that, and we all have a lot of books. That is why I'm not sharing anything. I don't want you to write anything, because we all know that. I just wanted to speak so that we are able to try to speak. As in my previous video, I informed that we are Pakistani and we don't know how to talk and how to elaborate our case in English, and definitely we are so much scared with MRCPCH, as we are, you know, the FCPS and MCPS, these are the exams we have just gone through, and we know the consultant, we can speak Urdu in that, and we can speak Sindhi in that as well, also Pashto in that. But in MRCPCH, we have to speak in the English and we have to elaborate it, and this is very hype creating exam as well, so expensive too. So we are too much confused in this time of period. So this is why we have to speak, we have to practice. This is why I am here, right? So I'm just telling you that I don't want you to just make my notes, and I don't want you to just give you my notes. I don't want you to just write everything, because I know that at that level we know each and everything. we know every book as well. But if somebody wants me to write notes and write, so that's it about the facial nerve palsy, and this is the verbal examination. I am just explaining it again and again to you people, that I'll be making video with the patient and then I'll be posting it soon, so that we know how to do examination as well. This is the verbal thing, and that will be the examination with the patient. But again, I don't want you to write each and everything. This is the facial nerve, how it start, how it end, because I know that we at that level we all know, and we know where it is written, how to read it. You know, there are hundreds of videos on the YouTube, there are hundreds of books, we all knew it. But thing is that for the sake of preparation, I'm just making it so that I can memorize the step as well, and the person who is preparing for herself or their self for examination, so they can also, you know, prepare the verbal examination. And then I'll be posting soon, inshallah ta'ala, the examination of with the patient, so it will be more helpful for us. Okay, thank you so much again, and for the more video, you guys can subscribe my channel and press the bell icon, so that you guys can have notification for my videos. Thank you so much.